Hello friends, welcome back to my channel. Today is January 1st, 2021, and hopefully you've had a great start for the year. This video is going to be a brief look at the current COVID-19 numbers provided by the Shelby County Health Department and the City of Memphis/Shelby County COVID Task Force. So with that, let's dig into these numbers. Since March of this year, our total cases have been 67,198, or 7.1% of the Shelby County overall population. Of those numbers that have been tested, 91.8% have had a negative result. That's key. Keep this in mind. 91.8% have had negative results. This does not mean that somebody who's tested negative cannot test positive in the future, but that is a phenomenally good number. And while the percent of the positive results has actually been 8.2%, total tests divided by the total confirmed cases, the way that the overall positive rate seems to be calculated is taking the active COVID cases, adding that number of inactive or recovered COVID cases, and then adding the COVID deaths, and then dividing the sum against the total confirmed and probable COVID cases, hence the 9.7% number that we often see. Regardless, the overall recovery percentage to date is 89%, with only 1.3% of COVID cases resulting in death. But what does that 891 death number really mean? As we continue to hear rising numbers of people getting ill from COVID, and those people unfortunately dying from COVID-19, the overall context has not been communicated effectively by our health officials nor our political leaders. Yes, 891 people dying is a sad affair, especially from a virus. But so too is over 323 people that have died because they were murdered in Shelby County as of December 21st. Sadly, over 726 people die in Shelby County per month for a variety of reasons. To make matters worse is that the Shelby County Health Department can, but has not spoken about how COVID-19 has impacted those numbers. Again, has those numbers increased or have they decreased? As we examine the weekly test positivity rate, we see a difference in reporting test positivity showing a 9.5 rate. The health department explains this as the data will change as more information is flushed out. Looking at the weekly COVID-19 positivity rates graph overlaid with local government mandated events, coupled with holiday events, and even local protests that occurred, we can see the increases and decreases that happen over time. During the phase 1 and 2, we can see the logical increase of cases. While some may argue that the mask mandate was the reason for the decrease, but as I mentioned in my previous video, correlation does not equal causation. By that same logic, one could suggest that the reasons for the uptick were related to the protests that occurred between Memorial Day and Independence Day and in September. We do not see data that may explain the increase of COVID cases in the fall as seasonal changes occurred and as we always see an increase of illnesses. Regardless of the various opinions out there, trying to suggest correlation and causation that can be derived from this chart is reckless and lacks proper scholarship. Since April 2020, the percentage of people in the age brackets has remained nearly constant with little to no change outside of the increased individual numbers. As we examine the 891 COVID deaths broken down by age, we can see that all of our 55 and older group are the most susceptible for the risk of death from contracting COVID-19. The population is more likely to have existing medical issues that complicate their ability to fight off the virus. When looking at the impact of COVID-19 that has on men and women, it is important to remember that women in Shelby County make up 52.5% of the population and men make up only 47.5% of the population. Current numbers show that 56% of those infected with COVID-19 were women. This is only a 3.5% differential based upon gender. Taking that into account, deaths between men and women show that the death numbers are close to the gender demographics. Examining race and ethnicity, we see that the percentages for black African American people relate closely with the demographics from Memphis, whereas the percentages for white people follow closely between Memphis and Shelby County. What is troubling about the reported numbers is a lack of identification for Hispanic Latino people regarding the death numbers. We can assume that they make up the majority of the other people identified in the 8% of the COVID-related deaths. However, the data that would illustrate a truer impact on race and ethnicity based upon population centers throughout Shelby County has not been provided to the public. However, by using the map data provided by the Shelby County Health Department, illustrating testing area and those areas with increased COVID-19 positivity rates, we can see that the areas of downtown Memphis, as well as South Memphis and the northeast section of Memphis, were the hardest hit areas. Correlating that data and using illustrations from Dr. Elana Delavera's 2019 poverty fact sheet, we can see a correlation that people living in high poverty areas have tested positive for COVID-19. We also find that those areas have a higher number of black African American people living in poverty areas. It is again important to note that correlation does not always equal causation. Let us dive more into the fatality risk category data. As reported multiple times, healthcare associated areas have the highest exposure. These include over 14 major hospitals in Shelby County. These also include over 44 assisted living, rehabilitation facilities, and hospice care type locations throughout Shelby County that have had COVID-19 incidents. So 28.3% equates to 253 people of the 891 people that have reportedly died from COVID-19 fatalities since March 2020. Again, it is important to realize that 98 people 54 years and younger died from COVID-related deaths, while 793 people ages 55 and up died from COVID-related deaths, with the average age of death being 74 years of age. As noted by the state of Tennessee, life expectancy in Shelby County is 76 years of age. The Methodist Lebanon Healthcare published a 2019 health needs assessment that provides a comprehensive and stark medical evaluation for the residents of Shelby County that noted our residents have a very unhealthy population and noted a number of factors like obesity, nutrition, exercise, low food access, and a high heat index value as having been contributing factors for the poor health in Shelby County. Examining the healthcare facility numbers further, we can find that 166 deaths were associated with several assisted living and hospice care facilities, or 66% of the healthcare facility deaths, or 18.6% of the overall COVID-related deaths in Shelby County. It is important to state that these numbers do not suggest that these facilities acted improperly or with any neglect due to COVID-19. Additionally, it is important to realize that based upon the information from AARP, that the estimated average stay in assisted living facilities is between 2.5 to 3 years. Also, information from ResearchGate noted that the median length of time people stay in nursing homes ranges between 5 months to within 1 year prior to death. We know that people with poor health issues are the population that are more at risk, and we should advise them to take actions to protect themselves. The comorbidity percentages align with the medical issues people within Shelby County have, but the numbers provided are not fully broken out. Probably a more disturbing figure is the number of acute care and ICU beds that have been recently reported. As of December 30th, the number of acute care beds were listed as 2,057 and ICU beds were listed as 413. According to the Tennessee Hospital Association and the state of Tennessee total bed report, there is approximately 2,556 beds available between acute care and intensive care in Shelby County. On July 19th, the Shelby County Health Department reported the capacity for acute care was 2,437 and ICUs was at 436. On December 14th, the number further decreased to 2,147 acute care capacity, while ICUs remained at 436. However, the latest numbers reflected only 2,057 acute care beds having staffing and ICU beds being reduced to a 413 bed capacity. As capacity decreases, so does utilization. While I've heard anecdotal stories from medical friends that part of the reason relates to supposedly traveling nurses are going to better paying jobs in different regions, I have heard from some nurses that they have quit because they've been treated poorly by the administration. How true all this is uncertain. What is certain is the decrease of capacity. If we had the July capacity numbers, Shelby County utilization would be 73% green for acute care and 90% yellow for ICUs. Right after Christmas, the Safer at Home Health Directive went into effect. It reduced restaurants at 25% capacity, further devastating that industry and the thousands of people employed by those small businesses. Part of the health department's logic was surveys that they did, but given the sample size, the margin of error has to be large. Granted, the level of secrecy surrounding decisions is absurd, let alone when we look at the numbers as it relates to population, as well as looking at the numbers of people infected and recovered. We should demand more transparency. Yes, 891 people have died over the last 10 months in Shelby County due to complications to COVID-19. However, since then, therapeutics and 2 vaccines have been developed and distributed. Plus, we know what populations are at the greatest risk. More importantly, we know how to stem the prevention of COVID without closing businesses. So what are your thoughts? Has the Shelby County Health Department provided context that supports the actions they have taken? Do you think the media has failed to push for answers to these and other questions that would garner public support for restrictions? Or have people jumped on the bandwagon because a nurse or a doctor friend has told them how bad it is where they're at, while forgetting that they are seeing the worst cases on a daily basis? This is similar to how police officers and law enforcement officers see the worst in society on a daily basis. You need to be able to step back and put things into a broader context. Yes, people should take responsibility and take the actions to avoid transmitting COVID-19. It is my hope that this presentation has given you information put into context so that you can make your own decisions. Thank you and have a wonderful day.